This year's theme is health innovation, designing a better tomorrow. And so what we really want to do is examine the way technology aims to really deliver or help deliver and access and sustain kind of a healthy and high quality healthcare system. It's my pleasure to welcome both Julia Novik and CJ Bawa. Julia is the founder of Canada HealthNet. CJ is a lean coach. And in this session, they will really explore the gaps in healthcare, challenges that exist, backed by real-life case studies from hospitals and clinics. So let's all welcome Julia and CJ.
I worked across all the verticals of healthcare, started as a director of business development at McKinsey Health, and then moved on into the pharmaceutical industry. And the last 5 years, I've spent time in commercialization of innovative technologies in our healthcare system, working on personalized medicine. And that made me lead to believe that our healthcare system needs a movement. And I've started a movement with forming company Canada HealthNet. So how to improve our healthcare system? The first thing that we need to think about is we need to think about creating culture where people are valued. And what we mean by that is that right now, as I enter any healthcare facility or we work on innovation projects or any process improvement projects, the first reaction that you see from people is resistance to change. And resistance to anything new and something that may take away or eat their time. And I think sometimes we just forget the reason or the meaning behind what we're trying to achieve. And so we think that with any organization, we need to make sure that you align people to the same purpose and to the same focus. And by being able to do that, you can start moving along and start making those improvements and changes that you need. You really need to think about listening to the patients. A lot of times, we run around and doing things, but we don't necessarily take into account patient view perspective, which is extremely important. And of course, you need to have the right performance measures. For any business to be able to meet customer needs, you want to make sure you measure those performance measures that are required to meet those needs.
What makes the Quality Improvement and Patient Safety Conference unique is that we feature incredible keynote presentations. We feature insightful and very interactive workshops. And we also feature our quality improvement initiatives at a local level. So we feature our students, and we do so through both oral and poster presentations. And within all of this, we create a opportunity for interprofessional collaboration.
In any business, but especially in healthcare, you want to engage your staff. Your staff are the best ones. They know where the issues are. They know what the patients need. Talk to your nurses, talk to your administrative staff, talk to physicians, talk to everyone, and you will get the answers. You will find a solution. And of course, when you have this culture of where everybody belongs and feels valued, where everybody is aligned to the same vision, to the same purpose, and everyone has a focus, and you've got the performance measures, the right performance measures in place, it becomes not a difficult task to start working on those process improvements, to create the culture, what we call culture of continuous improvements and innovation. Because without that, no innovation really is successful when you don't have the right soil and the right ingredients for it.
We just want you to remember why you exist. You are there for the patient care. Anything which is not patient care, let's throw it out. That's the meaning of lean. Simple, common sense. So now, what has happened? Lean is picked up by hospitals. The whole state of Saskatchewan, the whole state, all the offices, including healthcare, have picked up on lean almost 15 years now. We have worked on lots of projects. Of course, we are in healthcare. I was doing one project with one library. A process used to take 4 months. It's done in 1 day today. In court, a process used to take 13 days. It's done in 2 minutes. We worked in one of the case study you will see, they have cut down their wait times by 50%.
We are very excited to partner with UTI and to be part of this global movement actually around healthcare improvements. Through my whole career in healthcare, it's all been around the improvements we can bring into the healthcare. One thing I did learn while working in healthcare, that because we are in a very we are in a public healthcare environment, and we also have a private side to the healthcare, which is insurance companies and some other type of alternative medicine and so on, that there's a lot of silos and a lot of sort of need to connect those silos to work together for the benefit of the patients, right? And with my experience in healthcare doing innovations, I've realized that one of the things that was missing for getting our innovations into the healthcare was a shift in the mindset. We still face a lot of challenges, right, to bringing the innovations into our healthcare system. But so this is how I came about around focusing on driving the improvements through lean. And many of you have heard the word lean. So I wanted to see if you can put your hand up or just give me an idea of what is lean?
From this workshop, from these conferences, these keynote speakers, we hope to really open your eyes to the different key issues that exist here in our system. Sometimes, even though it's very obvious, we may not realize because we've fallen into a routine of how we do things. So I think it's very important to have open discussions, ongoing discussions, and have a diverse perspective brought to the table, which is what UTIHI does. We are a very interdisciplinary team, which again gives us the power to see a problem from all of the different stakeholders' points of view. And I think this is really important because that is what really will drive change and is what will innovate the future of healthcare.
So we have a long way to go, and we believe that technology is key, but in order to get to the technology, in order to make it successful and get the right technologies in place, we need to embrace the culture of lean, the culture of continuous process improvements, so that everyone at every level of healthcare organization can look out and think about those things in order to bring them up, in order for us to identify and know what problems we have and what technologies we need.